doctors say their profession is in critical condition tonight. They claim their practices are being squeezed out by the government, insurance companies, and hospitals.
We are facing a critical time in medicine.
This is a national healthcare epidemic.
It's not a secret that reimbursements are declining and that the cost of medical care continues to rise.
There's increasing intrusion into what we do on a day-to-day basis.
As physicians are bought up by hospitals and other large foundations, there's going to be much less personalized care delivered to the patient.
It's really becoming a day-to-day struggle.
There really is no effective organization that speaks for us. Private practice medicine is confronting a lot of forces that are moving the practice of medicine toward an industrialized model.
I think probably the greatest challenge I have is balancing the business aspect in conjunction with the medicinal aspects, just taking care of patients.
Everyone is having the same issues. Costs are rising, reimbursements are declining. If I get to a point where my expenses exceed my revenue, I can't stay in business.
The largest problem we have is the time that I have to spend in non-patient care activities.
What can we do to help these small business owners operate their business with a lower bottom line?
We decided we're going to organize and preserve the private practice of medicine.
It could be incredibly powerful if everybody was on board.
The first thing that we needed to do was to save our practices money. So we formed a management services organization, which is going to help our practices thrive by reducing our costs.
When we first started talking to doctors, we'd say, have you taken a good look at what you're paying for X or Y? And they'd say, well, frankly not. We'd say, how good of a job is your billing company doing? And they'd say, I hope good.
PPD is really it's an organization that was created by doctors for doctors with the mission to just help people stay in private practice.
Private Practice Doctors is offering 5 services to save physician money in their practices. The first is a group purchasing organization, electronic medical records, billing services, insurance for our office staff, and banking services.
One of the big advantages to coming together is to form a collective voice. It takes advantage of economies of scale.
As an individual physician, you may think you're part of a GPO. Bottom line is you're not paying the bottom price. Let's get all the doctors together and let's try to leverage their buying power while still allowing them to maintain their own individual private practices.
Even one service alone, and as in my instance, the merchant services, that made enough sense for me to join.
I've been in practice since 1981. I've seen a lot of evolution in the way medicine is practiced. PPD seems to afford the opportunity to go back to practicing the medicine the way we want to.
I hope that physicians are going to be able to spend less time and less money on the business aspects of medicine and spend more time with patients.
I saw a lifeline, some way to climb out of this mess.
There is absolutely no reason for a dentist not to join Private Practice Doctors. This has been the best thing presented to me in 32 years. I will be saving most likely about $2,000 a month by being a member of PPD.
I can network with other doctors, we can leverage our buying power, we can decrease our costs.
Also, this is going to be an obvious basis for a referral network.
I think when people are told the truth, they see the benefits, they make their own choices. I think when they see what it is that PPD has to offer and what the potential is, they'll easily want to join.